Welcome to Sex on the Floor podcast. This podcast was created to help educate the public about problems with sex and intimacy and how this is tied to both physical and mental aspects. Hosted by myself, Dr. Molly Hart, a passionate pelvic floor physical therapist and owner of Pelvic Balance Physical Therapy, and by Dr. Katie Schubert, a phenomenal sex therapist and owner of Cypress Wellness Center. We are here to have a good time. We're here to keep it real with you all and to educate along the way. I'm so excited for you to join us. We strive to help many relationships prosper in fun, safe, and healthy intimacy. While listening to the show, please remember that this information is not meant to diagnose or treat any medical conditions. Please speak with your medical provider for all things related to your healthcare.
Welcome to Sex on the Floor. We are talking about female anatomy today. I'm Dr. Katie Schubert, and this is Dr. Molly Hart.
Hi, guys. Welcome back. So you're in for a special treat today because we're going to be talking all things female anatomy, and I'm really excited to go over this with you. This is an episode, if you're able to watch it on our YouTube channel, you're going to get way more out of it because I am going over pictures. But I'll do my best to describe and talk about normal anatomy. So that's another thing. We are talking about normal female anatomy. We have thought about this after just preparing for this episode. We'll probably do an episode in the future on abnormal things that we see with female anatomy, especially postpartum. And I do have some beautiful pictures that we can go over for that too, but that'll be in a different episode. So with that said, should we just kind of get into it, Katie?
Yeah, I think we should. I think to start off, you are a specialist in terms of like what anatomy looks like and how it works. The things that I typically see in the office are people who don't know much about their anatomy or about their partner's anatomy. So this will lend itself to both issues, right? Women needing to know about their anatomy, partners needing to know about their partner's anatomy. So as you talk, I'll just interject and maybe share some stories from what I've seen in my office as well.
I would love that. Yeah, absolutely. For me, I do quite a bit of education on anatomy, mainly for my females who have been raised in a very religious upbringing, where the female anatomy was super shamed and don't look at it, don't touch it. There is this big, it's so funny because like men, boys, if they play with their penis and their testicles, like it's kind of funny, haha, people don't really care. Men sit with their legs open. It's not a big deal for men to like adjust themselves in public, but like women, we're shamed from the very beginning as a child to not touch that area, to cross your legs. And so we're so incredibly disconnected. And we know that a lot of women learn their anatomy from movies, from shows, possibly from porn, not from proper sources. So I do go over anatomy when it's a problem with my patients, and but it isn't always a problem. It just depends. Either way, it's still important for people to understand the body. So what we'll do is we'll start with the vulva. I'm going to show a picture, and I'm also going to explain what are these anatomical terms that I'm using as well, because some people might be like, what's a vulva? Which is fine, by the way.
So many clients call the entire vulva just the vagina.
Yes.
So there's a whole lot of like just basic psychoed around using the correct terms, and understanding the difference, right? So knowing what the vagina is, what the purpose of the vagina is, what the vulva is, how it looks. And also, I think the biggest thing that I've noticed, that's an important part of the psychoeducation is how different vulvas look from each other, because when we see images in porn or out there, all of the vulvas that we have access to or that we see look the same. Yep. But the reality is that there's so much variety.
There's
in the shapes
variety. Yeah. And it's all normal and it's all it's all totally just healthy and normal. And yeah, it's so funny because I mean, I see a lot of vulvas, right, with my job, and there's just no one way that the vulva looks, just like there's no one way that a penis looks or testicles look. Like they all look similar, but they all look different, just like we all look similar and we all look different with every body part. It's the same thing down there. But the problem is that it's not even a problem. The reality is that we don't see a lot of people's genital regions. And so we don't have much to compare to, except for maybe the few people that you have seen. So there's just really a limited amount of access to seeing these genital regions, and so we have this preconceived notion of what it should look like. So let's start to go over this a little bit. So this whole area right here is called the vulva, and it actually isn't labeled on here, but that's what this picture is identifying. Up here we can see like where a woman's hair is. This is also an area I call like the pubic symphysis because there's a bone up underneath here, but this area on top above the clitoris where we'll see genital hair is called your mons pubis. Down here is what we traditionally think of as the clitoris, which I really want to go into this. So this little bulb right here, this is the bulb of the clitoris, and then this is the hood. That's that tissue that goes over top the clitoral bulb. And most people think the clitoris, that's all it is. It's just this little teeny dot here. That would be like thinking the penis, only the head of the penis is the penis. The clitoris is actually much bigger, and we're going to go into that. I also want to just start off saying there is no such thing as a G spot. That was something that was labeled by a male. I don't know if he was a doctor. I probably should have gone over that again before I did this podcast, but it was a male who I believe had his name started with a G, so he called it the G spot. It was something he found that was a more sensitive area. But really what it comes down to when we look at the pictures of the clitoris here later is you're just feeling the sensitivity on the back side of the clitoris. So the clitoris, if you want to think about, there's a front side and a back side. So this is the front side of it. It's like the same as saying, let's think about the penis, because that's so easy for us to see. So the penis has a front side and a back side, right? So we can stimulate the front side of the penis, and I can also stimulate the back side of the penis, and all of it's going to feel great typically for the guy. It's the same thing. So one way we can access it externally, one way we can access it vaginally at the top part of the vaginal canal, which is quote unquote where we think of as the G spot. But it's really just stimulating the clitoral tissues. Anyways, there's the clitoris up at the top here. And then we've got these two labia. So we've got this outer labia right here, or the labia majora, you'll hear. And this is tissue that can be really plump and fatty, and it can also be really thin. There's differences here for women. A more healthy tissue with more blood flow, you're going to see that there's more plumpness to it. But I have seen younger women who have healthy anatomy and it's not plump at all. Like it's very flat. And so I also think that's healthy. I just think there's, again, differences with the labia majora. As we go through perimenopause and menopause, as our hormones change, ladies, and our estrogen and progesterone declines, we will start to see something called atrophy that can occur. And that's where we'll see a shrinking of the labia majora and the labia minora. And if that's something that you're noticing your body is actually changing in the genital region, you can bring that up with your healthcare provider, and you can actually use a biological estrogen or a biological progesterone to help with that if there's also pelvic health concerns going on. I'm a huge fan of using biological hormones as we're going through these perimenopause and menopausal changes. So anyways, there's that outer tissue. And then on the inside is this labia minora, or it says on here, it says inner labia. And in this picture, you can see it's really small. Do you see how small this labia minora is? Some women are like this and some women are not. Some women have really long labia minora, and it almost has like a fluttery, like wing-like appearance, or I think it's like almost like this is a funny thing for me to say, but it's kind of like a pretty appearance of just this, I don't know, a wing-like appearance is the way I would describe it. Or if you think of, what are those fish that people get that are really pretty? What are those called? Oh my gosh, you know, they go in the bowl. What?
The beta fish?
Yeah, beta fish. It's almost like the fluttering of their fin, like how it's just really pretty. Like labia can look like that. It's very abstract looking. They don't look perfectly symmetrical labia. It depends on the females for how long that tissue is. So again, some women have shorter ones that are really clean and short looking like this, and some are longer and have that pretty appearance to it. The biggest thing to know is if you're 35 plus and you're noticing that this area is shrinking away and declining in the way it used to look, that's something you want to bring up to your healthcare provider. But otherwise, don't compare that to another person. Okay. Then we've got down here, this is your urethra. So we've got the clitoris up here and then the urethra down here. And then this hole is our vaginal opening. And then we go a little bit further and we have our rectal opening. So it's so interesting because I feel like a lot of women don't really, I've had people tell me, I thought you peed out of the vagina. They didn't realize that there was a separate opening for the urethra. Some people even think like the clitoris and the urethra, that's where you pee from, is from the clitoral region. So it's important to understand, like, no, you got your clitoris up top, right below that is the urethra. Below that is the vaginal opening. Then you've got your perineum, which is between the vagina and the rectum. And then down here, we've got our rectal opening. For men, if we want to kind of compare this to men, we know that men have the urethra within the penis, right? And so it's actually very similar anatomy. We'll go over this in a second. The only difference is that the female anatomy, the urethra is separate, but it's still below. So if you think about a male penis, the urethra is at the lower part of that penis. So it's the exact same thing. It's just we have it separated out. So there's that picture. Let me go now and show you a really fun picture of a comparison between the clitoris and the male penis. So here we can see this is the entirety of your clitoris, by the way. So this little glands or the head is what most women or most even men think of as the clitoris, but actually this whole entire thing is the clitoris. So here's the analogy I give. Men, they like the head to be more stimulated. We know that's the most sensitive part, but most men also want the shaft to be stimulated, don't they? Okay, so imagine a guy just trying to have sex only stimulating just the head. He could have an orgasm that way, but they prefer the whole area to be stimulated. So if I only stimulate this area, let's say with oral sex or with a vibrator, you're not getting the biggest bang for your buck, is what I would say. You really want to stimulate more area. So this is where the hood sits on top of this tissue. And you can see like this blue part is just like the shaft of the male penis. And then we've got all of this part that comes back and under. So we call this the crus. This is the bulb. And again, shaft, like I just said. So when you are doing vaginal stimulation and clitoral stimulation externally, you're hitting this clitoris from literally every angle as far as the stimulation goes. And it feels really good. Can I talk a little bit about masturbation right now? Or do you think I'm going to do that for another time?
I think that it's yeah. I mean, we're talking about female anatomy, so I think that a lot of the listeners would love to hear about masturbation as well.
Okay. So something I have found, and I've also learned this from you, is that we know the penis and the clitoris can get trained to orgasm via the way we masturbate. It gets trained that way. And so this is something I've really learned, and I've been loving this, and I've even like practiced this on myself, is if you only do external clitoral stimulation with a vibrator or with oral sex, when you then try to add in vaginal stimulation with it, it can confuse your ability to have an orgasm easily. It almost feels too overwhelming, and or maybe you lose sensation. Like it's too hard. So something that I've been having my females practice lately, who struggle with having they struggle with clitoral sensation in general and the ability to achieve an orgasm well again. This is typically something I see postpartum, is I have them now, I want you to use a vibrator, a dildo internally to stimulate the backside of the clitoris, and a vibrator externally on the clitoral tissues at the same time. And if we want to be able to do this even with intercourse, start to move that vaginal dildo in and out. So you're training that tissue to be sensitive on the posterior side or the back side of the clitoral tissue. You're training it to be stimulated with a little bit of movement with that external vibrator that you're using. So now when I go to have sex with my male partner, this would be somebody who's in a heterosexual relationship, my clitoris is now learned how to handle this type of stimulation, and it's incredible, and it can allow you then as a female to be able to have an orgasm easier during intercourse. Not that that needs to be the goal. I think as long as you're having an orgasm, no matter how it's happening, wonderful. But that's a way in which I've been teaching, because men are getting the whole penis stimulated when they're having sex. So in a way for us to get the whole clitoris stimulated while we're having sex, this is a way you can do it, but you do have to train the clitoris to be able to tolerate that properly.
Yeah, that's really
I don't know if you have thoughts on that.
No, I mean, I think I think it can be a little bit intimidating for women, especially if they're a little bit shy already about their anatomy. But there, you know, when you were talking about that, there are sex toys that will do both, right? Like things like the rabbit, which is like a dildo along with a clitoral vibrator. So I mean, I think it's fantastic so long as women are comfortable doing it, because let me tell you, if you begin to pair any kind of sexual arousal with anxiety or shame, it's so hard to unpair those things. And what I do, I mean, a large portion of my job is helping people unpair anxiety and shame with their sexuality. So I would just say, like, if you're experimenting with some of these things, just make sure that like you're doing it in a way that doesn't heighten any kind of anxiety or shame.
Yeah.
Because once that is paired, it's hard to unpair.
You know what's interesting is like we probably have kind of different personality types that are coming to us, in the sense of, like, my women that I'm going over this with, they call me and they're like, I used to have an awesome orgasm and I used to love masturbating, and now it sucks postpartum, and they're so comfortable with themselves and they're freaking pissed that the clitoris is not working the way they want it to. So they're like, and they'll like go through a list. They're like, I've tried this, I've tried that. And so this is something I do. This is a small piece of the education, is going over this and teaching them how to train the clitoris differently. But then I also have to do a lot of pelvic floor work with them to help improve blood flow, to help improve nerve sensitivity and proprioception. So it's typically, when I'm going over that education, it's not with my anxious women. It's with my women who like are so sad they've lost that sexual connection with themselves postpartum. So that's a really good point that you said that, like, because that's way too intimidating for the female who comes in not connected with herself, and like not even really aware of the clitoris. You would never start there.
Yeah, I would never suggest using any kind of dildo with women who have a lot of anxiety around their sexuality. Sometimes the easiest thing to use initially is a very small, like, bullets clitoral vibrator. It's very unintimidating because it's very small and it goes on your clitoris externally. So I would say dildos are for more advanced masturbators.
I agree with you. No, I actually 100% agree with that. Okay, so let's just go over some simple, I'm not going to get into crazy anatomy here, but I just want to go over a little bit of pelvic floor structures too, so people understand, and also all like the little nerves in here. So when we think of what is the pelvic floor, these tissues all down here, so you see these like little pink tissues on this diagram, these are all the pelvic floor tissues. And then these are like these little yellow things are the nerves that run through here. You can see there's a lot of nerves that innervate this area that are extremely important for us to understand. Here's another picture, and I like that this one on here, you can see that this one actually has one of those longer labias like we talked about, right?
Yeah.
See, it's a little bit more wavy. And then this tissue you're seeing right here, this is around the vaginal opening. This is actually hymen tissue. So the hymen is at the vaginal opening, and there's lots of different types of hymens too. I should have brought up a picture of that. If you ever type into Google hymen, there are multiple varieties of types of hymens, that tissue that blocks off the vaginal canal. Sometimes there's a hymen called like a non-perforated hymen, and that can be a very thick piece of tissue that's harder to break through, and that can make it difficult for women to even put a tampon in. and it can make it more difficult the first time that you have sex and then therefore after. And so I do treat women who have pain with intercourse who have these really thick hymens, but once the hymen is broken, it kind of has this kind of wavy appearance sometimes that looks, if you're looking at this picture, that looks like this on the outside of the vaginal opening. So here is a really important nerve I want to go over that is huge in the pelvic floor world, which is called your pudendal nerve. So this nerve is the nerve that supplies the entire vulva area, the vagina, the clitoris, the urethra area, and it's a huge culprit and when I'm seeing dysfunction in this area. What's really cool to understand about this pudendal nerve is it has 3 different branches. So there's one branch down here. You can see it says inferior rectal branch. It goes to the rectum. There's this perineal branch that goes to the perineum, kind of lower vaginal area. And then you've got this upper branch here that goes to the clitoris. So called dorsal branch of the pudendal nerve. Sometimes I'll just call it the clitoral branch to the pudendal nerve. And so some women after an injury, such as childbirth, such as a hysterectomy, such as like even a groin pull, they can injure a part of this, and depending on what branch is affected will affect where they're having dysfunction. And this is a huge part of what I will work on with rehab. So it's just important to know what nerve really innervates that area and how is it innervating it.
You know, the biggest thing that I see in my office is just a lot of people not knowing enough about their anatomy. So they don't realize that it's way easier to orgasm if you have direct clitoral stimulation. And then, you know, we start talking about that and they may not know how to stimulate their clitoris.
Yeah.
You know, sex education is dismal in the United States. And we're not taught any of that really. I mean, mostly kids and teens and young adults learn it from peers, but you know, their peers don't have any better information than they do often.
I know.
So, yeah, one of the resources I use quite often, I don't know, Molly, if you've heard about this, but the OMG Yes, it's like it's an online course that talks a lot about sex and gives names to sexual acts and kind of describes how they happen. And
That's awesome. OMG Yes, I love that.
Yes, yeah, I've had a lot of couples use it and really appreciate it, especially if they are missing a lot of that education around sexuality and sexual behaviors.
Okay, I'm gonna put that in my repertoire. I like that. So because I have some patients I could absolutely use that with then, just to help them get basic understanding, right?
Yeah.
Little side note, you have a daughter, I have a daughter. It's so funny because I'm teaching her correct anatomical terms. And so I'm like, wipe your vulva. I think we've talked about this. And I'm teaching her like, that's your vagina, that's your butt. I've had patients who've told me that their stepdaughters, so it's, you know, it's not their child. I've had women come in who are very in touch with their sexuality and their body, and they are raising stepchildren, daughters, who have moms who are not in touch. And it's been interesting to hear kind of their stories of this, of they're like, yeah, my 7-year-old stepdaughter the other day told me that her butt hurt and she's pointing to her vagina, and she's like, I didn't realize she didn't know this stuff. And so I think it's really an important thing for us as moms, especially, to learn our own anatomy for our own ability to understand our body, to connect with it appropriately, and also to know like what's wrong. If something's wrong down there and we don't really understand our anatomy, it is hard for us to differentiate and know who do we even need to go to help us. But especially for our daughters, to be able to properly teach them, hey, this is the urethra, this is the vagina, and when it feels age appropriate, this is the rectum. Because what if your child has a UTI? What if something happened to them sexually even? How are they, if they know the anatomy of their body, they can very clearly communicate to us, hey, this is what happened to this part of my body. So it's like, it's so funny because we sing songs like head, shoulders, knees and toes, knees and toes. We go over all these other anatomy things with our children. We want them to understand it, but then we don't give details about this area of our body. And they have very different functions, right? Like the urethra has a very different function than the rectum, and so does the vagina. So think about the mouth. Your child doesn't just call the mouth the mouth. They probably know that there's teeth. They probably know they have a tongue. They probably know they have lips. It's the exact same thing. So what other part of the body, and we need to know those things because we have to brush our teeth and take care of it. And so if we want our younger generation to be able to take care of themselves well and to be able to communicate well about their body, I do think it's so beautifully important for us as moms to learn this about ourselves, and then to be able to share that knowledge in a safe way with our daughters when you feel it's age appropriate. So that way they're not learning it from other people and learning it inappropriately. So that's my little, I don't know if you have thoughts on that, Katie.
I just have one other thought.
Yeah.
In therapy and mental health therapy, it's very clear that shame grows in dark areas, right? So like if something happens in a person's life and they've never spoken of it, they develop shame over it. So I think the easiest way for women to begin to feel less shameful about their sexuality and about their anatomy is to talk about it openly and share information and talk to your friends about your sexuality and your sex life. Like it's not shameful, like it's anything else, right? Like it's really anything else. When we look at, this is a little bit of a side note, but I'm gonna go there. When we look at like teen pregnancy rates and STI rates in other countries, they're so much lower than the United States because those parents have open conversations with their kids about sex and about, not only the consequences of sex, like pregnancy and STIs, but also all of the wonderful things that can come out of sexual relationships. So those kids are so much more open about it and therefore safer about it. When we look at the United States, our pregnancy rates, our teen pregnancy rates are sky high. Our STI rates are sky high because we feel so embarrassed and shameful talking about these things. And I think that what you're talking about, learning our anatomy and sharing those words with our daughters openly and unabashedly, that's really the first step in getting rid of that embarrassment and shame and allowing an atmosphere that we can talk about sex in healthy ways.
Yeah. And I've really come to this kind of aha moment, really, I would say more recently in my life, of it's so silly that we have sexualized the genital region in the way that we have. I mean, the urethra, it pees. Okay, it pees. There's nothing sexual about that. The rectum, it poops. We have to get rid of waste. There are two things that get rid of waste in our body. Like, it's so incredibly important for the function of the human body. And the vagina is meant for reproduction, and it is meant for the birthing of a child, possibly. Doesn't have to come out that way anymore, thank God, because of modern medicine. But these are things in our human body that are incredibly important for our functional survival. It's so sad that we've overly sexualized them, just like the breast. We've overly sexualized the breast, and the breasts are meant to feed a freaking baby. It's meant to feed a baby, to allow for human life to continue. Is there anything more beautiful than the fact that the female body can create a human, birth the human, and then feed the human? I mean, how are we not celebrating this versus making it sexual and it's disgusting, really, to me. Like, why has this become so sexualized and so taboo and so shameful? This is, I think, the biggest thing that I hope to get across with today's podcast is, like, we really need to love our human bodies way more than we do, and have so much more love and respect for them, for all that they are doing for us. I'm a very spiritual person. I don't need anybody to take on this viewpoint. I'm just sharing my viewpoints on life. But, like, I view myself as a soul, And my soul is just sitting in this vessel of this human body, and this human body is allowing me to experience this physical earth that we are on. That's the way I view the physical body. And it's the most beautiful thing. And we just need to love it and respect every little aspect of what it's able to do for us and listen to it. So many people are not in touch with their human body, which is a big factor of what I have to do in my therapy. And teaching them to start to listen to what the human body is trying to tell them. Our society has taught us, let's mask everything that human body is trying to tell you. Oh, you're feeling sad? I have a solution for that. Oh, you're feeling pain? I have a solution for that. We don't ever want to listen to these messages. Your intuition, we're taught, like, so many people don't know how to listen to that intuition message inside of them. And they're following these arbitrary, stupid messages that the society has perpetuated, that social media is perpetuating. And then they wonder why they're lost, why they don't feel whole. And it's like, because you're not connected with yourself. So I do think it's so important for us as women, especially because men don't have this problem as much, to learn to appreciate and respect the female genital region, because it's such an important part for us and our upbringing in our life. Okay.
Agree. 100%.
Okay. I don't know if there's any other, do you want me to go over some other, let me go over this last little bit here, and then we'll kind of wrap it up today. We talked about pudendal nerve. I just want to show you, these are nerves that come out of your spine that innervate all these areas nearby. So why is that important? Is because any type of nerve issues that are going on in the spinal region can affect this area of your body. Again, just kind of getting connected with the human body overall. Is there any pictures that you feel like we didn't cover today, Katie, that you really wanted to cover? I didn't go over the floor as much as I would have liked to, but that's fine.
Yeah. I mean, I think that we covered a lot of that already in previous episodes. But no, I mean, I think it was a good basic overview. And again, we're always open to listeners messaging us and letting us know if they have any additional questions, and we'll be sure to cover those questions in previous upcoming episodes.
We can even do a whole nother episode on this, where I can go over like the uterus structures. I can go over like cross-sectional stuff if we want to. I have a picture of what it looks like when a woman's pregnant, like the anatomical. Last little plug, and then we're gonna wrap it up, is all of these pictures are from Pelvic Guru. Tracy Shear is somebody I personally know. She's an incredible pelvic floor. I don't even know if she practices pelvic floor PT anymore. She's just an incredible business owner at this point. She has something that she has created called the Pelvic Guru and the Pelvic Health Alliance. I feel like I'm maybe not saying that perfectly well. If you're a member with her, you can have access to all these pictures. That's how I'm able to share her pictures on here. If you're a healthcare provider that happens to be listening to this podcast, if you really want incredible knowledge and resources on pelvic health for male and female, I would hands down say to join her group, or go to her for any type of resources beyond what we're covering on here. And I just wanted to give her a shout out since we are using her pictures today. So bye guys. Thank you so much for listening, and we will see you at the next Well, we won't see you, but we will connect with you at the next podcast episode. Bye.
We are Dr. Molly Hart and Dr. Katie Schubert, and you've been listening to Sex on the Floor podcast. We really hope that you enjoyed this episode. If you have any questions and want to get in contact with us, you can follow us on Instagram at Dr. Molly Hart and at Dr. Katie Schubert, on Facebook at Pelvic Balance PT and at Dr. Katie Schubert. And for more information about us on our websites, you can find us at pelvicbalancept.com and at drkatieschubert.com.